Welcome back to Metro Edition. Louisville's American Printing House for the Blind is the world's largest company that researches, develops, and manufactures products for people who are blind or visually impaired. Recently, they had another reason to celebrate.
Machines like this one have been churning out materials for the visually impaired for 150 years.
The printing house is truly a national treasure and a Louisville treasure.
Company staff and leaders gathered recently to mark the occasion.
January 23rd is the American Printing House for the Blind 150th Anniversary Celebration Day, and we urge all the citizens of our community to observe this very special recognition. Congratulations.
APH manufactures textbooks and magazines in braille and large print, recorded and recreational products, as well as daily living items.
The products and services we provide ensure that students who are blind and visually impaired have the educational materials they need in the appropriate accessible media, and that adults have access to the tools and materials they need to enjoy meaningful careers and productive lives.
The printing house employs about 320 people in a variety of jobs.
The American Printing House for the Blind is all about creating opportunities. The development and production of quality educational materials creates additional opportunities for employment, which in turn results in people more likely to become contributing members of this community.
To learn more about APH products and services, go to aph.org.
Dental decay is the most common disease affecting Americans today. Smile Kentucky is a unique partnership that hopes to get kids back on the right track to a lifelong habit of good dental hygiene.
Friday, February 1st, local dentists and hygienists gave more than 300 children a new smile. The children received free dental treatment as part of Smile Kentucky. The treatment took place at the University of Louisville School of Dentistry at 501 South Preston Street. The children receiving care came from 30 elementary schools from several different counties throughout the state.
February 1st is a national treatment day across the United States, but the program in Louisville is considered a model because of the community effort we bring together. We have over 500 volunteers here, not all dentists. Some people coordinate transportation, paperwork, but they're trying to fill what the U.S. Surgeon General calls the most common unmet health need, and that's tooth decay.
Many of the children have never visited a dentist. Others have problems that have gone untreated. Smile Kentucky will provide more than $120,000 of dental services. Kentucky's dental health ranks as one of the poorest in the nation. Local data from Smile Kentucky shows that 33% of the children screened in the program have obvious tooth decay.
So a lot of the kids who came in here this morning were in pain, they have a toothache, and maybe they've had a cavity that's gone untreated for months. They're going to leave here today with a new smile. Other kids may just get x-rays and fillings and sealants, but besides all the treatment, we're trying to teach the kids the importance of good oral health, and that's brushing and flossing and watching what you eat, not too much sugar.
Smile Kentucky is truly a community effort. More than 100 licensed dentists and hygienists provide the treatment. The University of Louisville School of Dentistry donates the use of its school and staff. Other community groups offer funding and support, such as the Louisville Water Company. Louisville's program is unique because of the scope and educational component. In addition to the free treatment, all students at the participating schools receive toothbrushes, toothpaste, and pure tap water bottles.
There are many children here today who are 9 and 10 years old who have never been to the dentist. There are some kids who've maybe been just once. In Kentucky, dental health it's one of the poorest in the nation. And there's a couple of reasons. Access to care. Some of these children here today are from counties outside of Louisville where there aren't as many dentists. Affordability. You know, all the kids who get treated here today don't have private dental insurance, or they don't have a Medicaid or a K-CHIP program. And you know, dental insurance is not something that you go out and purchase unless someone provides it for you.
The American Dental Association calls Smile Kentucky a model for community partnerships. Since 2003, Smile Kentucky has provided treatment to more than 1,400 children, free dental screenings to more than 20,000 children, and educational programs to 90,000 students.
The University of Louisville's Graduate Business School is working to meet the needs of working professionals. As a result, state-of-the-art teaching techniques and nationally ranked programs are relocating to the business district.
Downtown's the new location for University of Louisville's Graduate Business program, and the future Museum Plaza is a perfect site because
it makes us part of not just a landmark or signature facility here in our community, but an icon that will be recognized throughout the world.
UofL Center for Graduate and Executive Education will move into the top 5 floors of one of the 4 Museum Plaza buildings on Main Street.
This facility will marry what we think is the proud tradition of Louisville's history, the front of the building, with a futuristic design that takes full advantage of this kind of a view that you see here out over the rivers. This location in the heart of Louisville business community is going to be more convenient for the majority of our students. We envision a place where many of our students will simply leave work and walk to campus. It'll keep a group of young, active professionals downtown.
It really is a special university that has made the tremendous commitments that have been made up to this point and continue to make the commitments that they're making today.
Offices, classrooms, and study rooms will occupy its 40,000 square foot area.
By night, it's the home of our MBA programs, our MAC program. By day, it's going to be a high-end corporate and community learning center where companies and other community organizations can conduct training, host high-end conferences, and hold retreats.
Construction on the project is set to begin this year and finish in the fall of 2010.
Louisville's park system will be home to a new fitness and community center specifically designed for disabled children and adults. Here's a closer look at the plans for the MVP Sports Zone.
Mayor Abramson unveiled architectural plans for an $18 million complex, a public-private partnership which will be constructed at 10903 Brentlier Lane near Bardstown Road off the Gene Snyder Freeway.
This complex will include 6 golf holes designed by Fazio, and we'll have sports fields such as a softball field. Those 6 golf courses will allow this young lady in her wheelchair to go out onto the course and to play those holes because of the firmness of the material that will be designed. The building itself is a 91,000 square foot building that you see pictured here. It will have 2 swimming pools. One pool will again allow folks in wheelchairs to simply roll into the pool to enjoy the experience of swimming. The other will have laps for swimming for folks who are able to swim laps of that type. It'll have a weight room. It'll have 2 basketball courts. It will have 4 bowling lanes, all of which available for both abled and differently abled individuals to give them a chance to have this wonderful new community center.
Louisville Metro government purchased a 95-acre farm from the estate of May Mahoney, whose family called the property Twin Meadows. About 22 acres will be used for the MVP zone, with the rest remaining as open space and woodland. For more information about the MVP zone, visit louisvilleky.gov.
The mayor's Healthy Hometown movement will host a pedestrian summit in March to address issues of neighborhood walkability, access to transit, health, and exercise.
Mayor Abramson announced the city will host a pedestrian summit in March 2008. The summit is part of the mayor's Healthy Hometown movement, which encourages healthier lifestyle habits.
This summit will research and discussions will be held to produce our first ever community pedestrian plan, which would be completed, we hope, by June of 2008. The plan will serve as our guideline and guidebook toward making our community a more pedestrian-friendly hometown.
Additional information about scheduled events and activities surrounding the Pedestrian Summit are available at louisvilleky.gov/health/MHHM.